the COVID-19 experience, WHO, UNICEF and health agencies across the world have been on constant alert for outbreak of viral and infectious diseases. Now, this is to avert the disaster caused by the COVID-19 pandemic, especially those virus and infectious diseases that remain on the radar with possibility of an outbreak, just like diphtheria, an acute bacterial disease. It is one of the 6 childhood killer diseases with potential to spiral into epidemic proportions without effective prevention and control measures. Worldwide, the spread of diphtheria has reduced drastically in the past 5 decades, attributed mainly to widespread immunization and vaccination. But of recent, the disease is rearing its ugly head in Nigeria. The country recorded outbreaks in 2011, 2022, with the worst outbreak in 2023. From January, 11,500 suspected cases have been reported, with more than 7,000 confirmed cases and 453 deaths, mostly among children. In 21 out of the 36 states and the FCT, with Kano as the epicenter of the disease. Now, what are government and relevant agencies doing to control the spread of this potential danger to the well-being of Nigerians? We will get to hear from the expert, Dr. Ifedayo Adetifa, Director General, Nigeria Center for Disease Control. This is Weekend 5. I am Jummai Yusuf. First, let's get the news. The National Institute for Policy and Strategic Studies, NIMS, is engaging relevant stakeholders in the fight against corruption in Nigeria. Director General of NIMS, Professor Ayo Omotayo, is of the opinion that the best way to reduce corruption is by institutionalizing behavioral change approach in public and private sectors. To this end, the Institute has validated a curriculum to serve as a guide for public and private sector executives.
The easiest way to change attitudes and character is through education. And I think that's why the National Institute is going through this route. Streamline this into policies, into programs, and the country will be the benefit for it.
Is that there's a nexus between the media and Nigerian perception. Several occasions, Nigeria is being portrayed as being very corrupt, but in actual fact, is because sometimes investigations are not properly done before it comes out to the media.
We are at a level where we believe that we need behavioral change, and we believe that if we can eradicate corruption even to a 50% level, our society will be okay. We have a chance to change society, and we should be given the opportunity to do so.
But you can see the overwhelming influence and terrible influence that the executive has over other arms of the government. It shouldn't be so. And this is happening because of corruption. That's why when the DG says it undermines the rule of law, I quite agree with it. Because the rule of law cannot survive in an environment where money is what is respected.
Talking electoral matters, the national headquarters of INEC says the letter written by the legal officer of the commission in Kano State Office indicating that the commission had withdrawn from the appeal process in the ongoing Kano governorship election petition case was not authorized and has since been withdrawn, and the officer reprimanded. A statement by INEC National Commissioner for Information, Sam Olumekun, advised the public to discountenance the insinuation that the Commission has withdrawn from the case or even worse, abandoned the appeal. The statement further notes that while litigants join INEC in a case, the Commission is under obligation to respond accordingly, and the Commission has therefore instructed the lawyers to proceed in line with extant policy of the Commission. Now, let's bring you up to speed with other news, including the weather, as reports across Nigeria indicate that dust in the atmosphere is gradually disappearing with improvement in both vertical and horizontal visibility. Musa Aliu reports that the sudden change in weather for the last 3 days has left questions in the mind of Nigerians, most especially farmers.
The rainy season is not over yet in most parts of the country based on the 2023 seasonal prediction of the Nigerian Meteorological Agency, NIMET.
It's also probably the timing in terms of the rain. Sometime a couple of years ago, we've seen by now the rain that stopped, or rather a certain threshold we're looking at probably have reduced. But we're seeing an everyday reinforcement, as I'll put it that way.
However, the sudden change in weather in the last 3 days is raising questions as to whether or not the season is over. The confusion was more when the rain which accompanied the weather was not as clean as the normal rainwater. In this compound in Suleja, a lady showed me the rainwater she collected from Friday evening's rainfall. Residents of the Federal Capital Territory and environs also witnessed a similar situation.
At about early hours of day before yesterday, it was as if dust was coming in from all corners of the town, and the visibility was becoming changed, becoming darker a little and dull, as if it was going to rain, and there was no rain.
Nigerian Meteorological Agency says the 2023 rainy season will last till the first week of November in the north central and to December in the coastal cities. Musa Aliyu, NTA News.
And joining me via Zoom is the DG NIMET, Professor Mansour Matazu, to talk about the change in the weather recently with dust in the north and then downpour all through. What's going on?
Thank you very much, and good evening, Nigeria. True to the forecast we have issued out some days ago, that Nigeria will experience a sort of a transition, especially northern states, extreme northern fringes plus the north central states. We've seen incursion of dust particles to some level around Maiduguri and parts of Kano, up to reducing visibility up to 200 meters. And this came when the whole environment was really under moisture-laden southwest monsoon winds. So we got a combination of dust and moisture and enough energy in the atmosphere to trigger precipitation known as rainfall. And that is what we have seen in the last couple of days, last 48 hours. It has rained heavily. Yesterday in Abuja, almost 2 times, and in many northern states, including Maiduguri. And just as we've indicated in our forecast, the onset of rainy season also is similar to the cessation, the end of the season. So the season is coming to an end, and we are having a combination of this dual weather pattern. So, and as such, this suspended dust particles known as Harmattan dust in the atmosphere will also trigger and serve as precipitation or condensation nuclei, so to form the water droplet that will come as rainfall. And these droplets will come with the milky and also brownish color as a result of the dilution of the dust particles in the atmosphere. So, we really make some advisories, especially to citizens of the country, on what to do in such weather conditions.
People have complained of, milky rain and red rain across. We've seen flooding, rearing its heads in some parts of the north. What more should we expect?
Actually, for the northern states, with the exception of the high ground of Abuja and the Jos Plateau and the stretch of Mambila, the season will end plus minus between the first and second week of October, extending to third week, early parts of third week and the north central states also by fourth week of this October to first week of November, the rainfall will cease. So we are seeing the last component of the cessation period, and which is also associated with high convective activities due to high intensity sunshine, solar radiation. And this trigger what you call a convective rainfall activities, a high intensity storm within a short duration of time. And this is responsible for the flash floods we have seen in many parts of the northern states So the season is coming to an end, and we've made a lot of efforts to be providing impact-based forecast for the country on three-day basis, also with advisories on sectors in transportation, water resources, disaster management, and early warning systems for Nigerian citizens. So the season is coming to an end with a lot of extreme events, strong winds associated with the cessation period rainfall activities.
Professor Mansour Matazu, DG Naime, thank you so much for coming on Weekend File. We appreciate your input.
Thank you. Good evening, Nigerians. Thank you.
Still on the weather, one of the major highways that links Gombe and southern parts of Borno and northern parts of Adamawa State faces serious threat of collapse due to flooding that washed away a portion of the road and one of the bridges from Gombe. Abbas Mekano reports that over 150 hectares of farmlands and houses have been destroyed by the flood in Dadinkowa recently.
The 6th day of October will continue to linger in the minds of Dadinkowa residents due to devastating impact of flooding on both farmlands and houses. Over 150 hectares of farmlands and hundreds of houses were destroyed by flood following a heavy downpour. Dadinkowa town is about 40 kilometers from Gombe, the state capital, where the major road that links Gombe and Borno states faces serious threat of total collapse, as one of the major bridges along the way has been affected by the severe cases of flooding year in, year out.
Abu ne ba farau ba mu a wurinmu. Mun jima muna gani dan tun muna kananan yara muna samun wannan yanayi na ambaliyar ruwa a Dadinkowa. Musamman ga watan tara takwas zuwa watan goma muna samun wannan matsalolin ambaliyar ruwa.
We are appealing to government please to come and intervene about the issue of flooding of this area because we are suffering. This road is main road that is linking Gombe to Maiduguri, so the bridge is about to collapse.
Ruwa ya zo shi kusan iya kunkumi. Ruwa na nan yanzu haka a cikin fadamu babu wajen da mutum ma dai expecting ya ce nan gonan shi ne bare ma nuna wajen ba ma.
So far, no life was lost as a result of the disaster. However, the Dadinkowa bridge needs urgent intervention of the authority concerned to avoid its total collapse. In Gombe, Abbas Mekano, NTA News.
Meanwhile, the Director General National Emergency Management Agency, NEMA, Mustafa Habib Ahmed, has directed state emergency management agencies to immediately activate disaster management response units to tackle possible flooding following the release of water from Lagdo Dam in Cameroon. Correspondent Ilyasu Yakubu reports.
The Cameroonian authorities commenced the release of water from the Lagdo Dam on the 4th of October 2023. Affected communities in Adamawa, Taraba, Benue, Kogi, Niger, Nasarawa, Anambra, Bayelsa, and Imo State. DG NEMA said the agency has since deployed its search and rescue officers to the affected areas for possible evacuation.
The update from NEMA is that the agency has been alerted on the sudden increase in inundation of riparian communities and farmlands along the banks of River Niger in Adamawa, Taraba, and Benue states in the past 48 hours. The sudden situation is attributed to the rapid release of waters from Lagdo Dam in the Republic of Cameroon and has resulted in the displacement of several inhabitants of the affected communities.
This is the second time Lagdo Dam in Cameroon is releasing water this year, and NEMA said it will continue making effort to ensure Nigeria is not flooded as the country is in the valley neighboring 8 African countries of Benin, Burkina Faso, Cameroon, Chad, Cote d'Ivoire, Guinea, Mali, Niger, which poses great danger to Nigeria in the event of release of excess water from their dams. In Abuja, Ilyasu Yakubu, NTA News.
Now let's bring you up to speed with other news. The Abdul Samad Rabiu Africa Initiative, otherwise known as ASER Africa, a leading philanthropic organization, has commenced the construction of a state-of-the-art cancer treatment center in Ilori, the Kwara State capital. The foundation laying ceremony of the project was performed by the state governor, Abdul Rahman Abdul Razak. Raliat Ibrahim reports that the center is expected to provide services for the entire West African region.
The siting of the oncology center in the state is expected to save Nigeria from an annual loss of multi-million dollars to medical tourism that is chiefly in search for cancer-related treatments abroad. Chief Executive Officer ASR Africa, Dr. Ubon Udo, said Kwara State was top on the list among the 4 states that were eligible for the Foundation's Tertiary Health System Support Grant.
Part of our health interventions is what we call the Tertiary Health System Support Grant. And in 2021, we granted 4 states 2.5 billion naira each to intervene at tertiary level and provide services for the people of their states. As we speak, we're constructing a School of Medical Sciences in Sokoto State and nursing, a mother and child hospital in Ogun State.
Kwara State Governor Abdurrahman Abdul Razak, who commended Alhaji Abdul Samad Rabiu for the choice of Kwara to benefit in the 2.5 billion naira facility, announced that the project will be named Abdul Samad Rabiu Medical Center. He promised to give ASR Africa and Boa Group every support required to ensure the project is completed on time.
I commend my brother and friend Alhaji Samad Rabiu and ASR Africa for this gesture, and you have distinguished yourself as great Nigerian. I commend the foundation for the choice of Kwara for this unique facility.
By the time the facility is completed, it will become a first of its kind in North Central and a major referral center that would attract thousands of people from across Nigeria and beyond every year. Raliat Ibrahim, NTA News.
From health to education, as Gombe State University has graduated fresh sets of students in a combined convocation. Emmanuel Akilia reports that the members of the academia from across the country who attended the convocation ceremony harp on education development as the basis for growth and development of Nigeria.
This is the procession of academics led by the visitor to Gombe State University, Governor Muhammad Inouye Haya. It is the 10th, 11th, 12th and 13th combined convocation for the graduation of 5,944 students of the university established in 2005.
The university has brought education to the doorstep of over 18,000 students.
As we step out into the world as graduates, remember that we are the ambassador of this university.
Today, Gombe State University is ranked among the foremost educational institutions in this country.
To the visitor, the success recorded in the university is a source of encouragement to continue funding the education sector.
We are going to ensure that Gombe State University tuition fees remain within the affordable limits. But we must tell ourselves the bitter truth, which is government alone cannot continuously provide the financial needs of our higher institutions.
Distinguished Nigerians were conferred honorary degrees of the institution for various contributions to the development of the country.
The graduates who express satisfaction and happiness with the feat that they have achieved in education at this level. While some say they want to further their education, others would want to look at the Nigerian labor market to see the prospects and what it can offer them.
I am planning for my master's degree after my national youth service.
President Bola Ahmed Tinubu, represented by the Minister of Transport, Governor Muhammad Inouye Haya, the Executive Secretary of TED Fund, and other personalities had commissioned TED Fund projects in the university and attended the convocation lecture in Gombe. Emmanuel Akila, NTA News.
Now, to ensure safety on Nigerian roads, the Federal Road Safety Corps has recorded tremendous achievements in the areas of public education, sensitization and awareness creation, crash reduction, prompt rescue services and timely removal of obstructions on the nation's highways. Governor of Plateau State, Governor Caleb Mutfwang, reiterated this at the passing out parade of newly recruited cadets and trainees at the Road Marshal Assistant Training School, Shandam, Plateau State. Oyeyemi Ajayi has details.
Road Marshal Assistant Training School, Shandam, Plateau State, is one of the training centers where cadets and trainees of Federal Road Safety Corps were rigorously drilled for the task of maintaining sanity and safety on Nigerian roads. The graduation of these officers now increases the workforce of the Corps with assurance of better output. Governor of Plateau State, represented by the Commissioner for Transportation, Jatau Giang, on his part, charged the officers not to relax as the task of meeting and sustaining the expectations of the people for road safety must be met.
You must therefore brace up for the task ahead. Do not be found wanting. You must always remember yourselves that the responsibility of bringing an end to road traffic crashes in our country now lay particularly on your shoulders.
Talking about expectations from the new recruits, Corps Marshal Dauda Bio highlighted dexterity, perseverance, tenacity and discipline in the course of their duties.
I want to advise them they should be dedicated and focused, and they should maintain the level of integrity that the FRC is on. So that's very critical.
Other centers where the training were as well conducted include FRC Academy, Udi, Enugu State, Marshal's Inspectorate Training School, Owalero, Delta State, and Nigeria Army Training Center, Kotagora, Niger State. Oyeyemi Ajayi, NTA News.
Meanwhile, 2 people injured in a multiple road traffic crash this Saturday are currently receiving treatment at the National Hospital, Abuja. Our correspondent Onoto Yakubu, who was at the scene of the crash in Mabushi, Federal Capital Territory, brings us an eyewitness account.
The road traffic crash occurred at about 8:30 in the morning. 3 vehicles, a Honda Accord, Volkswagen Golf, and a Mazda were involved. Eyewitness and victims' accounts indicate that the Honda Accord driver lost control in an attempt to escape a couple of bus stop touts who were dragging steering wheel with him. In the process, the Honda crashed into the 2 other vehicles on motion and passengers who were standing by to board taxis.
I was on my own, inside my own car coming. There is a vehicle that was coming. It's like the Albury people were trying to stop the vehicle from coming passengers. And the other one trying to track the steering with another one. It was made to hit the other cars. And from there, it happened that many people were about to enter the vehicle. That is how it fell about 2 and enter across the gutters.
You had persons in your car. What is the state of the passengers in your vehicle?
I don't know how like this.
2 of the bus stop victims were injured, with a handful occupants of the vehicles also sustaining minor degree of injuries. However, operatives of the Mabushi Police Division, assisted by onlookers, mobilized the victims to the hospital. Onoto Yakubu, NTA News.
Weekend File will continue in a moment with more reports to push our conversation on controlling the menace of diphtheria in Nigeria. Don't go away. You're welcome back. And to push our conversation, let's take some reports. Diphtheria, a contagious infectious killer disease, resurfaced in some parts of Nigeria and is gradually spreading, raising concerns among managers of the country's health, even as death records surged to over 100, with Nigeria's health authorities placing a high alert on diphtheria and heightening surveillance. What must have been the cause in rising cases of this vaccine-preventable disease, and what precautionary measures have Nigerians, especially parents, taken? Olishe Adebo will tell us more.
Is a serious infection caused by strains of bacteria called Cronibacterium diphtheria that make toxins which can lead to difficulty in breathing, heart spasm, and even death. It went into obscurity for some decades as a result of aggressive immunization.
Since this expanded program of immunization started in late 70s and early 80s, millions of lives have been saved through immunization.
However, in December 2022, diphtheria re-emerged in Nigeria and cases are escalating in various states. As of October 3, 2023, more than 13,000 suspected cases have been reported and 8,406 cases confirmed from 114 local government areas in 19 states, including the FCT. In a UNICEF statement, most cases occurred in children aged 4 to 15 years who have not received even a single dose of the vital vaccine, and the outbreak in Nigeria has claimed 453 lives. While the risk factors revolve around poor vaccination, the federal government, through the Nigeria Center for Disease Control, NCDC, the National Primary Healthcare Development Agency, NPHCDA, have continued to respond to diphtheria outbreak across different states in the country, expanding vaccination coverage.
Our recent assessment as WHO, we still place diphtheria as highly infectious disease and as a cause of concern. We do applaud the government of Nigeria providing this vaccine free of charge in the communities.
The Task Force on Diphtheria Response is developing mechanism, activating a comprehensive response plan for early detection of cases, curtailing spread and preventing further transmission.
We would like to call on governors of affected states to institute face covering requirements, such as face masks in public gatherings. By so doing, we can add another intervention to slow the progress of this outbreak.
Parents as well as caregivers are expected to play a part by taking their children and wards from birth to 14 years to nearby health facilities for vaccination with the pentavalent vaccine. In Abuja, Olusheye Adiagbo, NTA News.
Officially designated by the federal government as the epicenter of the diphtheria outbreak, Kano State has recorded nearly 10,000 suspected cases of the disease, with more than 5,000 confirmed cases, in addition to 493 diphtheria-related deaths recorded. Elizabeth Yila reports that the state government has so far taken its awareness campaign to the communities in the state, and 22 out of the 44 local government areas have received immunization against the disease.
The outbreak of diphtheria in Kano started in December 2022. Since then, the numbers have been increasing exponentially. The state government immediately mobilized its workforce for quick response to forestall rapid spread of the infection.
What we do is what we call outbreak response. We normally reach to any community that informed us of rising number of suspected cases of diphtheria in the state. We investigate, take samples, and confirm whether it is diphtheria or it is any other thing. Then where it was confirmed that it is diphtheria, they were treated, their family members and all the contacts will be immunized.
Murtala Mohammed and the Infectious Disease Hospital were the two designated hospitals for isolation of diphtheria patients. A visit to one of the isolation centers revealed that the patients are receiving the necessary care and attention needed free, courtesy of the state government in collaboration with a development partner, MSF.
I think the number of diphtheria in Kano is the highest, the number of diphtheria in all West Africa. MSF, in collaboration with Minister of Health, they provide all the necessary support for case management.
There was a time this room was filled to the brim with patients of diphtheria, but with quick interventions and responses such as this, the cases of diphtheria in Kano State are gradually getting under control, and the number of cases are decreasing by the day. From Kano, Elizabeth Yila, NTA News.
Thank you, Elizabeth. And to talk more about efforts to control the menace of diphtheria in Nigeria, I have in the studio Dr. Ifedayo Adetifa. He's the Director General, Center for Disease Control. You're welcome to Weekend File.
Thank you for having me.
5 decades, no sign of diphtheria for a while, and suddenly it's out there. Why is there so much a cause of concern for this disease? Because after COVID, the mere mention of a disease, sends shivers down the spine of anybody listening or hearing about another disease coming out. And it's a known fact that most viruses and infectious diseases never go away.
Well, it's not entirely correct that we've not had diphtheria outbreak in 5 decades. If my memory serves me right, there was an outbreak in 2011 in one of...
No, I mean worldwide.
Okay.
Yes.
Well, worldwide is still mostly in our part of the world at the moment. But we did have a diphtheria outbreak in one of our IDP camps in security challenged areas in 2011. Unfortunately, I think the records suggest that outbreak was perhaps picked up even after it had ended. The reason why we've got diphtheria now is the same reason why we typically have disease outbreaks. Is you need to have a few things aligned. So you need a bug, a bacteria, a virus that is already present in the environment or that is newly introduced into populations. You need to find people who are susceptible to that bacteria, either because they've never been vaccinated against that to develop immune response, or it is a new pathogen like we saw with SARS-CoV-2. Then you need the other things like your transmission to occur from one person to the other. And apart from being susceptible, people have other things that can make them predisposed to illness, whether it's malnutrition, whether it's their socioeconomic status or the living conditions. And what has happened in this case is that all of these have come together now to fuel this ongoing outbreak. The biggest risk factor for us looking at the cases is the low vaccination coverage in cases. As the various reporters have said, most cases that are reported now, about 70% of them have not been vaccinated or are partially vaccinated. And as you know, I've seen from the report, most of these children are from the 5 to 14 or 5 to 15-year age group, which means that they were not immunized when they were infants. And they were infants 5 years ago, or they were infants 14 years ago. So you're talking about people who with susceptibility that have accumulated in the population from as far back as 2009. Okay, so for every year we have a bat cohort. If you do not vaccinate as many as possible of that bat cohort, you contribute to a pool of susceptible people who continue to accumulate in populations until other conditions are right that allows for a disease outbreak, and that's what we are seeing with the current diphtheria outbreak.
So you talked about the risks. So now when somebody is infected, what are the symptoms and what happens to the body?
Well, I'm actually grateful that the reports have done my job for me. They were very clear about the symptoms. So you have a fever. Of course, many things can cause a fever. People may have a cough. They may have swelling of the glands in their neck and under their jaw, which may give them a bull-like appearance for a while. Then they may have a cough. They may have difficulty in breathing or difficulty in swallowing. And if you had a look at their throat, then you might see a creamy to white patch at the back of their throat or on their tonsils. So these are the common symptoms of diphtheria. Occasionally, you may have presentation on the skin, so dermatological manifestations.
Is it for everybody?
It is for everybody. And indeed, as the reports show, with photographs from AKTH, from MMSH, we have seen all of these presentations in all of the cases that have been seen so far across the country.
And I've seen that there's a lot of an awareness campaign across the country. We just saw one on NTA now during the break, and that's on the federal government level, and we'll see what Kano is doing. So what about the other states? Because I see it's like prevalent in the northern part of the country.
Well, as part of ongoing response to the outbreak, as coordinated by the Diphtheria Emergency Task Force and working with partners, all of these efforts are actually being replicated in the 8 priority states at the moment. The various states are at different stages of adapting this advocacy or these communication materials. But of course, Kano is ahead. Jingles are also being aired, or calling programs are also already happening in some of the other states, Katsina, Jigawa, and some are about to come on board as well, given the reports that I listened to tonight on my way here.
Is it because of the diet or the environment?
No, this, I think we have data suggesting that there are significant immunity gaps in the population across the country, which is why this is a national outbreak, or why we are worried that more states may present. I think, as I said earlier, that for the states that have started, all of the ingredients are right, is that there's a large population of previously unvaccinated people or zero-dose infants, as has been suggested, and all the rest of the conditions have come together to make transmission occur. So Kano may be not surprising because of the large population. It's a very densely populated part of the country. That makes it easy for respiratory pathogens to be transmitted from one person to the other.
Okay, Professor Adetifa, we'll take a break. When we return, we'll be talking about the vaccines and availability. We'll be right back. Yeah, welcome back, and you're watching NTA Weekend File. We've been discussing controlling the menace of diphtheria in Nigeria, and my guest, Dr. Ifedayo Adetifa, Director General Center for Disease Control, is still in the studio. Doctor, let's talk about vaccines. UNICEF says it has given 9.3 million vaccines, with 4 million on the way to affected states, and there's so much concern, so much concentration on the national. Now, what are states doing? Especially, we hear reports that some people are refusing the vaccine. What are you doing about that?
Okay, this is a very good question. There are 2 sides to that. So, yes, because we have a routine immunization program for which certain numbers of vaccine doses are targeted for the children that are infants in that period. We now need more vaccines because we are dealing with an expanded age group, older age group, 5 to 14 years, who are normally not covered by the routine immunization schedule, which is why we need these additional doses. And as we continue to ramp up efforts to vaccinate the susceptible population so that we can turn off the tap that is producing these cases, even more vaccine doses will be required, which is why the government, through the Ministry of Health and NPHCDA, is working with partners, WHO, UNICEF, and others, to make sure that we have all of the vaccine doses we need to deliver campaigns in all of the high burden or high risk local governments.
Okay.
Yes.
Are the vaccines enough, and do you think that diphtheria, most people say, is being underreported? What are your views?
Well, it is possible. For various reasons, people live very far off. We've got parts of some of the affected states that are not as accessible to healthcare workers on account of security challenges, so we are not really sure about everything, the situation in those locations. So it is possible. Whether it's theoretically possible or it is the true situation, it is possible. But at the moment, we are very focused on what we can see. What we can see represents people that are suffering, that are at risk of dying from severe respiratory illness, and it's very important that we focus on dealing with them, even as we, working with states, level actors, are trying to see what's going on in what we call the zero reporting areas. So we know that the absence of report is not equal to the absence of disease, so we are not completely ignoring that scenario.
So what more do you need from stakeholders, and what advice do you have for Nigerians with children susceptible to this disease?
So the primary advice is what the reports have said. Children now, infants, parents, cultural, religious, community leaders, everyone who has influence should please make sure that people make use of every opportunity that is currently provided by government, federal and states, to make sure that their infants are vaccinated with pentavalent vaccines at 6, 10, and 14 weeks of life as provided for in our National Childhood Immunization Schedule. Okay. Also, in the context of the outbreak, where there are campaigns, it is important that the older children aged 4 and above who are targeted for these campaigns are also made available to receive the vaccines. It's not enough to have vaccines in states, in local governments, in refrigerators or cooler boxes. Vaccines need to go into arms for us to be able to protect ourselves and protect our population.
Okay, Dr. Ifedayo Adetifa, Director General, Center for Disease Control, thank you so much for coming on Weekend File to enlighten and educate Nigerians on the danger and a lot of concern on diphtheria disease. Thank you so much.
Thank you for having me.
We'll take a break. When we return, don't go away. You're welcome back. Up next is Sport Update on trending sports stories with Bade Adele as our guide. Thank you, Bade, and this wraps up Weekend File for this week. Thanks so much for watching. Thanks for your time. I am Jummai Yusuf.